السلام عليكم أصدقائي وأخواني صفحة العلاج في الهند. اليوم اللقاء مع الدكتور الكبير دكتور هيمنت شارما من مستشفى براتكشا. أوكي، راح نسأله بعض الأسئلة نستفاد من عندها والمرضى أيضا. Sir, you can explain about yourself for the patient.
So, my name is Dr. Hemant Sharma. I'm orthopedic surgeon. I work in Gurgaon, which is just near to the Delhi, which everyone knows is the capital of India. To tell you about my background, I did my basic training from India and then I went abroad and I trained myself in England and passed their exams like FRCS, did a fellowship in joint replacement surgery, which is a hip replacement, knee replacement, sports injuries, and also redo joint replacements, which have already been done and you need to do it again. And I've been working here for last 8 years now.
8 years.
8 years.
Okay. Okay, sir, we want to ask you about knee problems like arthritis and some other problem. What does make the patients replace his knee?
So first of all, what is knee arthritis? Knee arthritis just means a damage between the two bones of the knees.
Okay.
So if these are the two bones, so normally there is a gap. But once this gap decreases, they start rubbing against each other and patients develop arthritis.
Okay.
That's one.
Okay.
So if you have a look at the normal knee, you see how smooth it is. Absolutely clean and smooth. Just ignore my pen marks.
Yeah.
Otherwise it is very smooth. And in between there is a shock absorber. And this is a ligament which you call it as rabat.
Yeah.
And this is a gazroof. Kadaroof.
Yeah.
So what happens in arthritis, this smooth surface gets damaged.
Okay.
So we have stages. So if you have a look at this second one, you will find that there is a damage here. Compare it with the first one.
Okay.
And similarly, if you see the third stage, the damage is more.
Okay.
And when the damage becomes very severe, then the patients need a knee replacement.
Okay.
So question is, why do patients get arthritis? So number one, if you are overweight, and if you see females have got more commonly thyroid problems, so they are overweight. Compared to men, females are sedentary, less of work outside.
Yes.
So they tend to get more incidence of arthritis. Other reasons could be if you are suffering from a condition which can damage your joint even in a young age. For example, rheumatoid arthritis. That can affect even a 5 years old, 10 years old, 20 years old. So if you have got multiple joint pains and there are deformities in the hands, in the knees, get it checked by the doctor. You may be having rheumatoid arthritis and a rheumatoid specialist will give you special medicines so that the joints do not get damaged. But once they are damaged, then we come into the picture and patients have knee replacement surgery. Other reasons can be accident. Let us say somebody has an accident. In the accident, either they broke the lower part of this bone or upper part of this bone and the joint gets damaged. That can cause arthritis. Then if some people get an infection in the knee or infection in any joint, the bacteria eats away the smooth cartilage and makes a cartilage like that, and that can be a cause of arthritis. So age, as we grow old, you have it. There are some genetic factors, then accidents, weight, sedentary lifestyle, injuries, infections, and other diseases.
Okay. Sir, I hear that you always use for your patients this new technology by navigation system. Can you explain for us, for the people to understand?
So first of all, it's not a new technology. It has been used for a long time. I got trained in navigation in England, and in year 2004 onwards I've been seeing that. So navigation is a system in which the computer guides you how to carry out a knee or a hip replacement in a nearly perfect way.
Okay.
Computer will work if I know how to make it work. End of the day, it is the surgeon sitting behind the computer.
Yes.
Because computer doesn't have a brain. So basically with the navigation, for example, let us say somebody has got a bad knee and the knee is bent at an angle. So let us say this angle is 20 degrees.
Okay.
The computer will pick up this angle is 20 degrees, and then it will pick up how do we correct this 20 degrees to a straight angle, how much bone to cut, from where to cut, what is the size that is going to fit the patient,
Okay.
and it can tell me if my knee is stable in different positions, 0, 30 degrees, 45, 60, 90, and so on. In the end, we get a report something like this. So in this report, if you see, before the surgery, the patient has got a bend of 19.5 degrees.
Okay.
And this means the patient is unable to straighten the knee by 25 degrees, which means this patient's knee was 19.5 like this, and if this is a straight knee, 25 degrees like this.
Okay.
So after the computer surgery, I'm able to correct it to 0.5 and 0.0.
Full.
So I've got a complete straightening of the knee,
Yeah.
good alignment of the knee, there is no more bend in the knee, and patients, they get a report. So it's a fairly long report. You can say it has given me marks how I have done a knee replacement.
Yeah.
And patient can show it to their doctor, and that gives a confidence to the patient that, that at least the joint replacement has been done well. But the success just does not depend upon computer navigation, it depends upon the patient. Are the patients cooperative? Are they doing physiotherapy? And how about the weight
Doctor experience.
and things, doctor's experience, doctor's training, and of course
Yeah.
how operation has been carried out.
Okay. So, sir, now let's go to this point. What is major surgeries that most of Iraqi patients or other patients are come here to do?
See, first of all, there is nothing called minor surgery. For a patient, every surgery is a major surgery. And in every surgery, we want the maximum success, we want the maximum satisfaction of the patient.
Yeah.
So, obviously, we have seen people from Iraq, even from India, South Asia, you see they are overweight, they have got blood sugar, they have got blood pressure, they have got heart disease, and they have got bad joints. Knees more common than the hips, and we see a lot of shoulder joints also. So majority of patients have got bad knees, which require knee replacement, bad hips, which require hip replacement. But we are also getting patients who have had knee replacement in the past and they have failed for some reason. So there we have to do a revision knee replacement, which is called as a redo surgery. And redo surgery itself is a very complex surgery. Then we are getting a lot of bone tumor patients, young children, 12, 10, 20, and they have got bone tumors which require multiple doctors to treat, oncologists, cancer surgeons, myself, chemotherapy, and then radiotherapy in order to give them the best possible outcome. Since football seems to be a popular game in Iraq, we get lots of patients of injury to the ligaments inside the knee, and not only once, 3 times, 4 times, so many times they injure the ligament, and people are coming with shoulder injuries to the muscles. So, and infections, so bullet injuries, gunshots, who have been operated for 10, 11 times. The bones are short, bones are missing. These are the patients I would say are very complex because they need surgeries and a very long follow-up. Sometimes it takes 2 years for the bones to heal.
Yeah, because we see many patients, they do surgery in Iraq and fail, and do again and fail, and they come till the
Well,
situation.
yeah, surgery can fail anywhere with all due
Yeah.
respect, but it is just that I do my best, whatever I can
Yes,
do.
yes. Thank you, sir. Okay. So, sir, now about joint replacement you are using here for the patients. Like which is some of the patients ask about American, Indian, they confuse.
Okay.
Can you?
First of all, there's nothing called the best joint. There's nothing called the best country, nothing called the best person, best doctor. There's nothing best. So all these joint replacements, implant that we use, they have a track record, which means they have been used in the past. There is a joint registry where we are supposed to maintain a data of each and every patient. If it has failed, why it failed, did it fail due to surgeon factors or it failed due to the implant problem. Most of the implant companies, American companies such as Johnson & Johnson, Stryker, Zimmer, Smith & Nephew, Biomed, and many others. If I have missed it, don't mind it. Then we have got lots of German companies also. But there is a very minute difference. I mean, to a layman, I tell them it is just like, it's very hard to say is best car the BMW or the Audi or Mercedes or Porsche. All of them are German cars. There is a very slight difference. So end of the day, my suggestion to the patient is don't choose the implant. Choose the right doctor in the hospital. Because if you force the doctor to do X implant, he may not have done that implant, but he will not say no to you.
Yeah.
And then there will be a failure. Because so let doctor do whatever he's comfortable in doing, whatever he's doing maximum.
Okay, right. Thank you.
Thank you.
Sir, we just ask you about, we see many patients are visited Dr. Hemant Sharma even by name.
Thank you very much. I think patient is a patient. We should not differentiate from where it is. This is the basic oath we take when we become a doctor. Which country, which religion, what color, we should not differentiate. There are many doctors better than me, probably more competent than me, but it's not just the surgery that patient is looking for. They're looking for a trust in a person who's interpreting it. They're looking for transparency. They're looking for a doctor who can look after them after the surgery, who listens to their problems. And it is the touch of a doctor that matters more than how good or bad surgery he has done. It is the communication ability. It is the listening ability that I have to be a good listener for small problems.
Yes.
Because patient satisfaction just does not depend upon the implant, less cost, computer. It depends upon the behavior of the doctor, availability of the doctor, how good he is in communicating, and of course skills do come in the way, but what I mean to say is it's a multiple factors. So I've been operating for last 8 years and they love me so much, and I think I've got so many blessings from them, probably less blessings from my parents than what the patients from Iraq give me.
Yes, sir. We see most of the patients want Dr. Hemant. Sometimes they come to ask us why Dr. name.
Thank you, Hemant.
And now, sir, we talk about types of knee replacement.
Yes.
Because many people don't know what's the good one, which one is lower quality, which one is good quality.
Nice. Okay, that is also very relevant for your patient. We here, and when I was in UK, USA, I used to use the standard implants, which is like American made and UK made, mainly American made, like Zimmer, Smith and Nephew and Stryker. The reason I use them, and they are expensive also, is because they have been time tested. So those knees have been in business for almost 30 years.
Okay.
So we started in late 60s and early 70s knee replacement in USA. So we have got the results of 30 years. So I would like to implant those knees in your family member or your patient, so they can have long-term good results.
Okay, these best
knee replacements, yes.
Okay. Sir, another question about knee replacement patients. After how many days they can walk in hospital, and after how long time they can walk normally?
Yes, that is also very important. For that, you have to have a very good physiotherapy setup like we have.
Okay.
So normally, when I do my knee operation, then we ask them to start exercise the same evening.
Okay.
Lifting the leg up,
Same
moving
day.
same day. And if some patient who is young and we do half knee replacement, then we make them walk in the same evening. They can walk the same evening, no problem.
Nice.
But most of the patients who are old, 60, 65, 70, those old ladies who have not walked for many days or weeks, we make them walk next day with support, obviously.
Okay.
So I always tell that next 2 to 4 weeks they should use a walker frame. If both knees are done, then they can come on a stick, walk with the help of a stick. And normally at 6 weeks they can even give up the stick. So you can say 6 weeks to 8 weeks they should be walking normally.